For many egg donors, one of the most intimidating elements of the egg donation process is the egg retrieval. For the egg retrieval, you have to be under general anesthesia, which means they give you anesthesia and you're essentially completely asleep. You're not aware of anything, you can't feel anything, and you will be in the OR. It's a very, very simple procedure. It usually just takes like 10-15 minutes. They're going into your vagina and they're carefully taking out the eggs from your ovaries. You're not being sliced open or anything like that. You're not being cut open. Very, very simple procedure, very quick. Again, the anesthesia is really the most intense part of it. So what will happen is you'll be given a time to show up at the surgery center. Oftentimes the surgery center is part of the fertility clinic you've been going to. It's just a separate section of the building usually. So you'll show up whenever they tell you to show up. You'll have to sign paperwork. They will ask you to arrive with a companion because you will need somebody to drive you home afterwards. You'll arrive, they'll tell you to come in just like comfy pajamas or loose clothing, whatever, no makeup. If you wear contacts, they'll ask you to come with your glasses on. I really recommend, the night before, as you fall asleep, just envisioning yourself being surrounded in this like soothing golden light, being filled with that golden light, knowing that it's keeping you safe, that your body is healthy. When you wake up the next morning and you're getting ready to go in for the surgery, continually reminding yourself that the people that will be performing the surgery, the anesthesiologists that will be administering the anesthesia, they do this exact same procedure multiple times a day. Multiple times a day. They do it all the time. This is not some risky, weird procedure that they've never done before. They do it all the time. It's so simple. The level of danger is and risk is like that. It's tiny. You are incredibly safe. It's okay to feel nervous. It's natural to feel nervous, but to know that you do not have to be afraid for your life. Again, just seeing yourself, feel yourself surrounded in that golden protective light, making sure that you're continuing to breathe, because sometimes when we get nervous, we stop breathing. I can't tell you to drink water because you will not be allowed to drink water before the surgery. So no water, unfortunately, but you can take deep breaths. Deep breaths, that golden light, remembering that the people that will be caring for you, they are experts in what they do, continuing to stay calm. And then after you've signed all the paperwork, they'll usually take you back. You'll say goodbye to your companion. They'll have you change into like a hospital gown kind of thing and put on these weird socks and booties, tie your hair back. They will draw some blood and they will start an IV, typically in the top of your hand. Sometimes they administer fluids. The anesthesiologist will come and talk to you, check with you about different things, make sure you're all good. Typically, they can help you kind of stay calm as well. Sometimes you're left alone for a little bit, and in a lot of clinics, you're hearing other people be wheeled in next to you. You'll have curtains around you, so you won't be able to see them, but you'll be able to hear them. If you find that stressful, ask them if you can bring in like headphones and just put some, or like even earplugs if you just want silence, or headphones and play some music to just stay calm. Close your eyes, take those deep breaths. I think that's actually much preferable than listening to what's going on around you, because you'll hear people coming out of anesthesia that are all loopy. You might hear other people that are anxious. So again, pop in those earplugs or headphones and listen to some soothing music. And then they'll likely eventually administer something that will make you calm, but not necessarily fall asleep. Sometimes they give fentanyl. There's different medications that they use. They'll let you know what the medication is. They'll let you know what you can expect to feel. Sometimes the anesthesiologist administers the anesthesia that will actually put you to sleep before you're in the OR, but a lot of times they'll take you to the OR. You'll be moved over onto the table, where they will do the retrieval. A lot of times they're working to help you stay calm, talking to you about all sorts of stuff, like what meal you're gonna have after. Everybody is usually actively trying to keep you calm, and then you'll lie down. The anesthesiologist will probably say, okay, count back from 10 to 1, you'll go 10, 9, and you'll be out. From that point forward, you will not feel anything. You will not be aware of anything. You will take the best nap you've ever had in your life. Next time you wake up, you'll be back in the recovery room, feeling nice and loopy, like loose-lipped, very talkative. By that point, the anxiety should be long gone. The nurse will be with you, making sure you're feeling okay. It's very normal to have some cramping. The doctor will come in, probably let you know how many eggs were retrieved, how you did, what you can expect from recovery. And then, after about 30, 45 minutes or so, they'll likely release you. You can get dressed and go home with your companion and get some food and whatnot. So yeah, again, know that it's totally normal, natural to be nervous about anesthesia, about the surgery, but that those people know what they're doing. They're taking care of you. The risk is so incredibly minimal. It's such an easy, fast procedure. Nobody's cutting into you. Just let yourself enjoy that nap and the loopy drugs. All right, if you have any questions about anesthesia or the egg retrieval, let me know in the comments below.